Does having sexual intercourse twice a day or every day is necessary when in your fertile period? A lot of couples ask me, is use of lubricants okay when you're trying to conceive during the sexual intercourse? Most of the lubricants, even water-based, are sperm toxic. Lying down after sexual intercourse is mandatory when you are trying to conceive. A gorgeous female today, while discussing about her pregnancy planning, shared with me, Doctor, I feel like cleaning up after having sexual intercourse. And if I don't lie for 1 hour after sexual intercourse, how will I get pregnant? And when I get up, whole semen comes out of my vagina. I'm really stressed about it. So I felt the need of talking about this and wanted you to educate you all about sex myths when you're trying to conceive. So let's talk about it. So talking about some sex myths when you're trying to conceive, it is very important to talk about it because constantly worrying about what should you do, what you should not do can take out the pleasure right out of your intimacy. Lying down after sexual intercourse is mandatory when you are trying to conceive. There's no scientific evidence behind it, but yes, you can lie down for 15 minutes and after sexual intercourse and then go to washroom. Number 2, no scientific evidence suggests any kind of sexual activity position which can enhance the chances of conception. Number 3, is it better to have sex at a certain specific time during the day, whether it's day or night? There is no scientific evidence suggesting the same. Does having sexual intercourse twice a day or every day is necessary when in your fertile period, or does it reduce the chances of conception? Let me explain a bit about it. Egg, when ovulates in women's body, stays there for 24 hours and is available to sperm for fertilization. And the sperm, when ejaculated in the vagina, stays there for 72 hours, which means 3 days, and is available for fertilization for 3 days in women's reproductive tract. So having sexual intercourse every day or once in alternate day or once in 2 days during your fertile period is okay. So you can have sexual intercourse in your fertile period as per your comfort or convenience. A lot of couples ask me, is use of lubricants okay when you're trying to conceive during the sexual intercourse? Most of the lubricants, even water-based, are sperm toxic or they reduce the motility of sperm in women's reproductive tract. So you should avoid the use of lubricants when you are trying to conceive. Some women ask me, can I pee after sex? Yes, it is okay to pass urine, go to washroom after having sexual intercourse even when you're trying to conceive. Yes, you should avoid vaginal douching because that can wash out the semen out of your vagina, and generally also vaginal douching should be avoided. So folks, some semen will always flow back out of the vagina after sexual intercourse along with your cervical mucus and vaginal discharge. So if you feel some discharge flowing out of your vagina after sexual intercourse, it is okay. Do not panic or stress about it. So अब जो आप कर सकते हैं, having sexual intercourse around your fertile period or fertile window, which is around your ovulation date, can increase the chances of conception. So you should know when is your fertile period, how do you calculate it. So there are some signs of the body which you can notice around the ovulation day. Your cervical mucus or the discharge coming out of your vagina can become more clear or watery. Sometimes some women can feel rise in the temperature of their body, but the specific signs are difficult to really get into. Otherwise, you can also use ovulation test kits or also called as LH test kits. And you can also opt for ultrasound for follicular monitoring by doctor because that is the most precise way to check for your ovulation. And then as per the follicle monitoring scans, you can have timed intercourse and plan your pregnancy. You can also calculate your fertile period as per your menstrual cycle length. So ovulation generally happens 14 days prior to your next cycle date, which is like the expected cycle date minus 14 days. For example, in a woman with 28 days of cycle, the most fertile period is day 12 to 14, and the ovulation will most likely happen on day 14. Whereas in a woman with a cycle of 35 days, her most fertile period would be day 19 to 21. So you can calculate your day of ovulation, which happens generally 14 days prior to your next period date. So my message to all of you is every fertility journey is different. Keep trying. Miracles do take little time to happen. Keep your hopes alive.